Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. Don't forget to subscribe and follow to stay up to date. Today we'll be talking about when to decide to go to the dentist, how often you need to go to the dentist, and about routine checkups. It's recommended to go to the dentist at least once a year. Many problems you can't see and you can't know by yourself that you even have them. So when you go to the dentist can check up and see if you need some kind of small treatments instead of waiting for 20 years and then going in and needing a lot of big treatments. In most of the cases, if you can brush your teeth and you have good hygiene and you go once a year to a dentist or even dental hygienist, just cleaning a little bit of the plaque or between the teeth, you can go without any treatments at all. But if you don't go to the dentist and you have some kind of problems that are undiagnosed, then you need to treat them, because if you need to have a tooth filling, you need to have it before it becomes a root canal or extraction and implants. So you need to know in what condition you're in. Your dentist will tell you when the next time you should come in because you were not very good in the hygienical aspect of cleaning the teeth. It's a problem. So you need to come in every 3 months, every half a year. If you have great hygiene, you can also come in once a year. When you don't go to the dentist, or you go to the dentist when you have some kind of pain or something like this, you have pain in one tooth, but all the other teeth probably have some kind of problems as well. So maybe you have pain in one tooth, but you have a lot of different holes or caries or problems with all the other teeth. First of all, your dentist will check if there are any problems with the soft tissue, not the teeth. Because if you're smoking, for example, you have a high risk for cancer. So the doctor checks if you have any irregularities on the gingiva or the soft tissues. Then your dentist will make a couple of x-rays to see if you have any holes, any caries, any cavities in the teeth themselves. Then your doctor can tell you what you're doing right and what you're doing wrong in the process of the maintenance of your teeth. So if you're brushing your teeth very well or not, or if you have any problems. If you have some big treatments, for example, like crowns or implants, the doctor can check the integrity of the crowns or check the implants. Sometimes you have some kind of inflammation because something was stuck, or you have residues of cement or different kinds of things around the implants or around the crowns. So all of those things the doctor can see every time you go to him. The best results, of course, the doctor says that everything is fine and that you're doing a great job. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course don't forget to subscribe, like, and follow. Thank you, and see you next time.